Hello, everyone. Thank you so much for joining us. This is the OHP 1115 Medicaid Waiver Community Engagement webinar. This is a monthly webinar series that we do in English and Spanish, and you are here for the July webinar, where we will be talking about housing service and supports included in this Medicaid waiver. So if that's what you're here for, you're in the right place. A tiny bit of housekeeping as we get started. We have over 100 folks here on the line, so if you can keep yourselves muted, unless it's a good opportunity to talk, that'll help us get the information to you all. We also are recording this session, so you will have access to it later and can share it with any colleagues or any other folks who you think might find this information useful. We welcome you to, because there's so many people, it can be useful to use the chat to ask questions or to share your thoughts. Anything that's put in the chat, we will have and record and use for our future webinars and also to help inform people who are working on different parts of this waiver and different parts of these services that we're going to be talking about today. So that can be a really useful tool, both so that you can speak at a time where maybe 100 people might want to talk at once, and also a way that we can make sure that your voice gets heard and we can bring that to decision makers and to other people who are trying to get all of these interesting and new waiver things out into the world. We're at that phase where we're moving from planning to implementation. We also have an email address that you can see here on the screen. It is 1115waiver.renewal@odhsoha.oregon.gov. Feel free to use that at any time to get information to us, to ask questions. You can use that during the webinar, after the webinar, anytime. And I see that Molly has put it in the chat so that you can easily grab it. And once again, thank you so much for joining us. Now, before we get into today's topics, I do want to give our various presenters and webinar helpers a chance to say hello. I will start, and then I'll call on folks. My name is Jessica Diaz. I use she, her pronouns, and I work for the Oregon Health Authority as a community engagement manager, and I'm one of our presenters here today. I'm next going to pass it to Rebecca.
Thanks, Jessica. Hi, everyone. I'm Rebecca Donnell. I'm an innovator agent with the External Relations Division at OHA, and I'm one of the presenters today. My pronouns are she, her as well.
Thank you. And then Lene, do you want to go next?
Sure. I'm Lene Bowles. I work for OHA as well. I am a contract administrator in the Social Determinants of Health Department, and I will be one of your presenters today.
And then next, I'm going to pass it to some folks who are helping out with the chat and with some of the background things. Molly, can I call on you next?
Yeah, good morning. I'm Molly Taylor, she, her pronouns. I work on the community engagement team with Jessica under OHA, and I'm going to be here helping kind of man the chat. Welcome.
And then Suli, can you introduce yourself?
Hi, good morning, everyone. Suli Rosales, she, her, ella pronouns. Happy to be here, and I'm also on the community engagement team, and happy to help support today.
And then I think last but not least for out loud introductions, Sean, if you can introduce yourself.
Hi, I'm Sean. I'm OHP's member communications coordinator, and I'll be helping out with chat questions today.
Thank you so much. And I know there are a lot of I see a lot of names I know who are internal to state agencies and who are external. So feel free to use the chat to introduce yourself, to talk a little about if you have specific things that really are driving you to be in this webinar, specific topics. or if you want to share the organization you work for or volunteer with, or any other information, I want to open up the chat throughout this presentation for that, knowing that we can't, if all 123 of us introduce ourselves out loud, that would be all of our hour. But I also want to make sure people have that opportunity. And with that, I'm going to dive into today's topics. So what we're going to cover today is we're going to ground ourselves first with OHA's health equity and community engagement commitments. We're going to spend a little bit of time just doing overview of the terminology and the concepts that we're going to be talking about as it relates to the waiver. And then we're going to dig a little deeper into what that is going to look like when it comes to housing, services, and supports. And that's within what we're calling health-related social needs. Please feel free at any point in time, if we are using jargon, if we are using acronyms, we're going to try our best to explain them, but we also recognize that us state workers live in that world and might not realize what we're doing. So please also feel free to hold us accountable for anything like that. And we're going to try to make sure we have some time for feedback and questions. But I do want to start by saying that there are many things that are being built right now, and there are many things that we may not have answers for. And that doesn't mean that your questions aren't valuable, but that we might have to bring them back, and they might actually help inform how we are building these systems. So whether or not we have a ready answer for you, please, please, please feel free to drop it in the chat to let us know, and we will answer the questions that we can. With that said, I will start by walking us through the Oregon Health Authority's health equity goal. And this is a really important thing that I'm going to read word for word because I want to make sure that we lay out our health equity goal correctly. Oregon will have established a health system that creates health equity when all people can reach their full health potential and well-being and are not disadvantaged by their race, ethnicity, language, disability, age, gender, gender identity, sexual orientation, social class, intersections among these communities or identities, or other socially determined circumstances. Achieving health equity requires the ongoing collaboration of all regions and sectors of the state, including tribal governments, to address the equitable distribution or redistribution of resources and power, and recognizing, reconciling, and rectifying historical and contemporary injustices. Moving on to our commitment to community engagement. We acknowledge the state of Oregon and its systems has perpetuated institutional, systemic, and structural barriers that have silenced the voices of communities over time. We recognize community engaged health improvement is a long-term and adapting process. Oregon Health Authority is committed to meaningful engagement with communities via traditional and emerging mechanisms for community engagement. We are committed to transparency. Information will be openly and honestly shared so that everyone has the benefit of the same information. And we welcome feedback about how to make community engagement more inclusive and accessible. So as we go through our content today, which will be mostly sharing information with you all, we do want to make sure that we are staying true to these principles, these goals, and these commitments. And so that's why we try to start all of these webinars with the same language to reaffirm that. And I'm going to hand this over to Rebecca next to talk a little bit more about the Oregon Health Plan and our Medicaid waiver.
Thank you so much, Jessica. I have the privilege of walking us through some of the basic terminology so that we are not overwhelming folks with jargon, that we actually take the time to talk through a couple of the terms that we frequently use when we're talking about Medicaid and the 1115 Medicaid waiver. So I'll jump in. Medicaid is a federal program that is administered by each state. So it's a partnership between the federal government, the Centers for Medicaid and Medicare, and in our case, Oregon. And in Oregon, our Medicaid program is called the Oregon Health Plan. So that's what commonly people think of when they think of Medicaid benefits within Oregon. We're really talking, it's the same thing, the Oregon Health Plan. Within the Oregon Health Plan, we have coordinated care organizations that are our local OHP health plans that provide the coverage for medical, dental, and mental health care. And some people aren't enrolled in a coordinated care organization, but the vast majority of folks that are on the Oregon Health Plan are enrolled in a coordinated care organization in their region. Also, generally speaking, Oregon Health Plan eligibility is based on income. There may be other factors for certain groups or eligibility criteria for other groups, but in general, by and large, the way you're determined if you're eligible for Oregon Health Plan is largely based on income. The Oregon Health Plan has been growing, particularly during COVID, and at this time, about 1 in 4 people in Oregon get their healthcare coverage through the Oregon Health Plan. Next slide. So you'll hear us refer throughout the presentation, and many of you signed up to learn about what was included in what we call the 1115 Medicaid waiver. And I just want to take a moment and kind of explain exactly what a waiver is. As I mentioned before, Medicaid is a federal program and each state administers their own Medicaid program. The federal government sets out a standard set of minimum requirements or rules around how a Medicaid program will operate. And it's things around eligibility, benefit requirements, all of those types of things. So they have sort of a blueprint that every state has to follow. However, states can ask for some of the federal rules to be waived, and they do this so that they can states can adopt innovative ways in serving people through Medicaid programs. They can cover more people, they can cover more services, and they can truly kind of look at ways to improve the delivery of healthcare for Medicaid recipients. And so the federal government will meet with a state and go over its application for a waiver. If approved, they have the waiver for 5 years, and every 5 years you reapply. We just went through this process in 2022 and met with CMS over an 8-month period, worked with them to go over what we wanted to include in our waiver, and I'll talk a little bit more about that in a moment. And then we came to an agreement and the waiver was approved as of end of September of 2022, September 28th, 2022. So over the next 5 years, we'll be implementing the waiver, and then we'll need to reapply at the end of those 5 years. Next slide. Jessica touched on this a little bit, but the overarching goal and what we wanted to put forth to the federal government was we really wanted this opportunity with this waiver to advance health equity within Oregon. And we focused in certain areas. We wanted to make sure that everyone maintained their health coverage so that we are covering as many people in Oregon as possible and helping people maintain their coverage. That we were focusing on improving health outcomes by addressing health-related social needs. So we'll talk more about that today. that we were putting in place smart and flexible spending strategies for health-related social needs and health equity programs. And so we really thought creatively about how to fund those services and programs, and that we wanted to create a more equitable and culturally and linguistically responsive healthcare system. So those are the underlying actions that we put forth to the federal government in our waiver application to advanced health equity. Next slide. So in 2022, Healthier Oregon opened a pathway to free full Oregon health plan coverage for adults 19 to 25 and 55 and older, no matter their immigration status. We've expanded that starting July 1, so close to 40,000 commonly referred to CALM members, which is citizen waived medical members, ages 26 to 54, will move from emergency coverage to full OHP benefits July 1. Citizen waived medical or CALM members currently enrolled through the marketplace at healthcare.gov will need to report their new full OHP benefits to the marketplace after they receive their eligibility notice. So as of July 1, 2023, people of any age or immigration status may be eligible for free full Oregon health plan benefits. So it's really important for folks to make sure that they're, well, I think that's the next slide, actually. Yes, it is. Next slide, Jessica.
Yeah, I did just want to say, my apologies. We wrote this slide before July 1, so it says people will, but we're now past July 1. So I just wanted to call out that Healthier Oregon
Oh
has
my
been
gosh, we are in
expanded.
July. Yeah.
And so
As of July 1,
yeah.
as of July 1.
So there's
As of July 1.
there's some future tense language on the slide that is completely on me. My apologies. That has happened, and we are currently, like, I haven't been able to check, but I believe people have moved already into full benefits from emergency only coverage. I just had to shout that out really fast, but I'll hand it back over to you.
Intellectually, I knew it was the July 4th weekend over, the last weekend, but somehow my brain didn't skip there either because we did these before the July 4th weekend. Thanks for that, Jessica. So it's really important for folks who want to see if they are eligible for these new benefits through OHP and the waiver. It's very important for people to sign up for or maintain their OHP coverage. And it's there's numerous ways to do it. You can do it online through the One portal, can be the quickest and easiest way to do that, one.oregon.gov. There's the paper forms that you can fill out. You can call in. There's the phone number there. There's local DHS offices, and there's assisters, and there's a link to finding a local assister that would be able to help folks get enrolled or check their current status or eligibility. Next slide. Okay, now I'm going to go through some of those health-related social needs that were included as new benefits that we were able to receive through the waiver. So for Oregon Health Plan members who are experiencing certain life transitions, they're going to be eligible to receive certain social supports that are covered as an OHP benefit. They must have a medical need for the services, and those supports are around housing, nutrition, and climate needs. Next slide. This is a detailed breakdown of what it means to be in one of those transition populations eligible for the health-related services. Youth with special healthcare needs up to age 26, adults and youth released from custody, adults released from behavioral health residential settings, youth involved in child welfare, including youth transitioning out of child welfare, individuals transitioning from Medicaid only to Medicaid, Medicare dual status, individuals who are homeless or at risk of becoming homeless, and individuals at high risk clinical need who reside in a region that are experiencing extreme weather events. Now, I want to put some asterisks on some of these, specifically around adults and youth released from custody. That's really referring to adults and youth released from state or tribal custody, including prisons, local correctional facilities, tribal correctional facilities, or the Oregon State Hospital. In terms of the definition of homelessness or at risk for homelessness, we're using the HUD definition. So I want to make sure we underscore that. That's often a question. And then in terms of an extreme weather situation, that extreme weather would be as declared by the governor or federal government. Those are just some asterisks to these different categories. Next slide. Okay, this is a very busy slide, but I'm going to kind of break it down for you. It has much more detail about what's included in those nutrition, housing, and climate categories. Lene is going to take you through, because today we're focusing on housing, so I'm not going to really go through the housing piece of it, but I'll give you a brief overview of the climate and nutrition and case management supports. And these will be topics for future webinars to really go in depth in some of these areas. So for more detail around the climate support, it's medically necessary air conditioners, heaters, humidifiers, air filtration devices, generators, and refrigerators. So it's supporting someone's medical needs to make sure that they can maintain their health during a climate event. As I mentioned, Lene is going to get really into the details of housing today. And so I'll leave that for Lene to go over. In terms of nutrition supports, the benefits cover nutrition, counseling, and education, medically tailored meals up to 3 meals a day for 6 months. Fruits and vegetables prescriptions up to 6 months. And then there's case management services available for all of these that
Oh, Rebecca, it looks like you're muted. And I think I was trying to figure out if I was freezing or if someone else was freezing or we all were.
Oh, okay. Yeah, I thought I just got disconnected for a second. Okay.
Oh, you're back. Perfect.
I'm back. Next slide, my last slide, I think. So I'm sure people are wondering, what's the timeline for benefits? And we're currently required through our agreement with the federal government, our waiver agreement, to roll out health-related social needs services by 2025. And we expect to begin offering services in 2024. It'll be a phased in approach to rolling out these services, as you can imagine. All of these services and the different providers and working with community-based organizations, housing, nutrition, climate support providers, will take time to develop those operational relationships and to really effectively be able to roll these out. So it'll be a phased in approach. We're taking time to develop the programs to meet the highest needs of folks first, and then we're involving partners outside the traditional healthcare system. So as I mentioned, community-based organizations and housing and food providers. And we're trying to create those meaningful connections to make sure we're providing services with the whole person in mind and really wrapping services around them and making sure that they're we're better serving individuals. One thing that I didn't mention before on the last slide was that, and I'll end with this comment, is just another operational piece of this is that per the waiver, all of these services must not replace local, state, or federally funded services someone is already receiving. So these are things that are meant to be additional services to what folks are already receiving. And so that's a big consideration as we're rolling this out as well in this phased in approach. So thank you for your time today. I'll hand it over to Lene to really take us through the housing portion.
Awesome. Thank you, Rebecca. So I'm going to attempt to go through the housing supported services. I'll give you a little bit of background though. I said in introduction that I was a contract administrator, and the contracts that I oversee are for rental assistance for the SPMI population and the SUD populations. So this kind of flows into my daily work. So I'm going to try to go into a deeper dive and just talk a little bit more about what the waiver will cover, hopefully. So rent temporary housing up to 6 months, right? So it's going to be available to the specific translation or transition populations that Rebecca talked about. Could be rental payments for apartments, single room occupancy units, single family homes, multifamily homes, mobile home communities, accessory to dwelling units, co-housing communities, middle housing types, and manufactured homes. We hope we've covered all type of housing scenarios. We may have missed a few, but I think that as we move forward, we'll be able to identify, or folks will identify for us, and we can maybe come up with some approvals. The payments are going to be for short-term, or they could be for short-term motel or hotel stays, and payments for transitional and recovery housing, including bridge, site-based population, specific to and community living programs that may or may not offer supportive services and programming. Next slide. This could also cover some utility costs for up to 6 months. So if you think about, as we talk about utilities, we also talk about low barrier access, right? So things that maybe could prevent folks to accessing housing, such as your utilities, water, gas, electric. Those are all things that could prohibit a person being successful in housing. Of course, internet and phone, those are sometimes they can be lifeline issues. Folks need internet to access services. They need phone for emergencies. So this waiver could also cover those things, those items. Payment for non-refundable, non-reoccurring utility setup costs for utilities and essential housing. I talked about that a little bit just a second ago. Payment to resolve debts related to unpaid utility bills and cover non-refundable, non-reoccurring utility setup costs to restart and discontinue service. So again, low barrier access to services. Next slide. Medically necessary home accessibility modifications and remediation services. So We would like to also, this waiver could also eliminate known home-based health and safety risks to ensure occupants' health and safety. And that might look like maybe there's a disability or a handicap. So rails, ramps, pathways, fencing, grip bars, remediation. So maybe there's some pest eradication that needs to happen. It could be carpet or mold removal, installation of washable curtains or synthetic blinds to prevent allergens, lead abatement. So again, we're trying to reduce barriers to access housing. Next slide. Pre-tenancy and housing navigation services. So we also, I think we want to, how would I say this? We want to also provide supports, right? So we want to help develop a housing plan, help the member achieve stability, help them achieve their goals. We want to review and update and modify the plan to reflect their current needs and preferences and address existing or reoccurring housing retention barriers. Maybe they need help looking for housing, presenting options, assisting in completing applications, payment of any housing application or inspection fees. Those are really important because sometimes those are also barriers to obtain housing, because maybe they can pay the rent, but they don't have the money for the fees or the housing applications, or maybe they can't, they have a problem completing applications. So we want to be able to provide those services as well. As needed, facilitating enrollment in the local continuum of care, coordinated, so the CCO, their entry system. So we might need to help with that, and hopefully we'll be able to find services that can support the community. Next slide.
I just want to chime in and say for this last slide, it really is ways in which we are connecting to housing systems in addition to our medical system. So that continuum of care's coordinated entry system, those are existing housing local groups. And so really not only taking the medical model. Thanks for letting me chime in.
Next slide. There we go. So maybe they need identification for or other required documentation to get into the housing. We want the living environment to be safe and ready for move-in. So we're going to help with that or assist with that. Assisting in details of the move and securing transportation prior to transition and on move-in day. So that might look like I might secure the apartment, but I may not have a way to move my things. The waiver can help support that. Educating, engaging, communicating with and advocating with landlords, assisting in communicating with the landlord and property manager, providing training and resources to assist in complying with the lease. I can tell you that's huge. That is super important. For the contracts that I oversee currently, that is the biggest part of managing the contract, is really maintaining relationships with landlords and property managers. So that's going to be really big and super important. Establishing procedures and contacts to retain housing, including developing a housing support crisis plan. That too is super important as we begin to talk about folks with disabilities in the community. And so I think partnering with other organizations is going to be really big to help kind of diffuse some of the things that can arise in the community. Next slide. This is part 3, assisting in development of independent living skills. Talked about that a little bit on the last slide. So some wrap services, some type of I'm looking for a word here, but some type of wrap services, skills training is going to be important to help folks remain being housed, helping secure and maintain entitlements and benefits that may be needed to find and keep housing, help enrolling in local school and college systems. All of those are really important to help a person be successful in the future. So I kind of see it as we help them out the gate. We provide some supports so that they are able to be, they can sustain as they move forward in the future and be independent. Providing connections to expert community resources to address issues such as assistance with breaking a lease due to unhealthy living conditions, assisting individuals in assessing their necessary medical, social, educational, legal, and other services. Again, sustainability in the community. A lot of our folks may have not had the coaching or the skills training in the past. And so we want them to be sufficient and stable once they achieve their apartment status. Next slide. Tennessee Sustaining Services. So we want to assist, I just talked about this, I'm ahead of myself. We want them to maintain housing and stability, right? We want to educate, engage, communicate with, and advocate on behalf of the individual with landlords. Assist the individual in communicating with the landlord and property manager, providing training and resources to assist the member in complying with the individual's lease. Again, super important for stability. Establishing procedures and contacts to retain housing, including developing a supported housing crisis plan. Again, these are all super important things, which is probably why it's been mentioned a couple times, because that's what's going to help our community member be able to maintain their housing. Next slide. We want to assist people to develop independent living skills they need to remain housed, help them get and keep entitlements and benefits that may be needed to help housing stability. We want to help enroll in local school and college systems. Providing connections to expert community resources and to address issues impacting housing, such as assistance. I think we've just talked about this, breaking leases, living conditions, all of those things. So again, we're driving this because again, we're going to provide the support up front, but these things need to be in place moving forward so that again, we can sustain this. And hopefully we're going to have a better, stable community out there if we can provide them supports to housing.
And I did want to call out, this feels a little redundant because it's being technically correct in that it is pre-tenancy and the tenant, like while people are seeking housing and while they have housing. So a lot of the things that are available before someone is housed are also going to be available while they are maintaining their housing. So a little bit of redundancy just to make sure that we call that out really clearly.
But I think, Jessica, these are, again, they're very important because they need the supports before, during, and after.
Absolutely.
Yeah. Next slide. So one-time transition, moving costs and housing deposits. So we talked a little bit about this in the slides before. So we could cover security deposits. We could cover first, last month of rent. We could cover setup fees, deposits for utilities, old debt. We could cover the first month coverage of utilities. What about, I think about connection fees, right? So sometimes a utility company may run credit, you might need a deposit. This waiver could cover some of those items. Moving and relocation expenses, health and safety services, such as pest eradication and one-time cleaning, pantry stocking.
No, I'm just listening to the meeting.
Pantry stocking and basic household goods and furniture. So again, we are reducing barriers to access housing and to become independent and stable. This is, I think that this will be super helpful for folks in our communities, just to get them off on the right foot, get them off to a good start. Next slide. Need services and support now. Community resources are listed at the following website. And that could include services for food and nutrition, health, housing, transportation, childcare, aging, and people with disabilities. And if you all have any other resources that we've missed, please feel free to share that with us in the chat. But we try to do just a brief overview, be as detailed as possible. We may have missed some stuff, but I think that this is a great step moving forward for stability. And Jess, I think I'm going to pass it over to you.
Thank you so much, Rebecca and Lene, for helping to present today. Yes, so I do want to say, this slide particularly, we recognize that we're talking about things that are being built and are not yet fully functional. And so we do want to make sure that we are calling out many parts of this round of waiver implementation will go live next calendar year into 2025. But that there is a whole constellation of resources, either statewide, and this website, to admit, we are the state, so we know state resources a bit better than local resources. But we have put together quite a few different resources that people can pursue right away. And I also want to call out that we are very aware that as we build the ways in which we can start to fund these mechanisms that we talked today with Medicaid dollars, and that's the new thing, the new and exciting piece of this puzzle, but that we have to fit into that ecosystem of what is already out there and what people are already accessing. We're not allowed to duplicate or replace what people are currently able to get. So we have to find ways in which we can add to what is already out there. And so resources that you are recommending for folks in your communities or statewide, I see some really, really useful comments and questions in the chat around really building from and acknowledging the organizations, the networks that are already in process, already doing this great work, and how we can make sure that we are able to put Medicaid dollars into that in a way that's going to help people and not create more headache for everyone, while also making sure that we are meeting the requirements of the federal government and the setters for Medicare and Medicaid services. And we have to be in that spot in between. So that's what we're seeking to do with this waiver, which is pretty ambitious. This is a very ambitious waiver. I do see some folks asking about where this recording will be or how to get to the PowerPoint slides. I do want to say out loud, we always put our PowerPoint presentations and a recording of our monthly presentations up on our public website. And I see that Sean has put a link there so you can easily access it. I also want to call out that there's a lot in the waiver that we didn't talk about today. As you saw with our deep dive into what the housing supports and services are, there's a lot. We could talk for days about things that are included in the waiver, which is why we have a monthly webinar, and we'll focus on different topics each month. But if you wanted more information about things like our expected timeline, if you wanted to learn about some of the other aspects of the waiver, there are recorded sessions where you can learn more, and we'll continue to be committed to doing that. And with that, we have a few minutes. Go to our final slide. We always end in the same sorts of questions. We want to take a moment, for people to be able to put in the chat any questions, comments, anything you want us to acknowledge, whether it's today or as we move forward to build some of these systems that we're talking about. We also want to know hey, did we help you feel like you understand how our Medicaid waiver works and at least a little bit of what's included in this current round? And if there are ways that we can better reach you or engage with the communities you serve, you are a part of, you work with, as well as what topics you want us to dive deeper into in the future. I will say that we are planning on doing for August the climate related services. So those air conditioners, generators, air purifiers, talk more about that. So we do have a plan for next month, and that's based on your feedback from past webinars, but that we are continuing to build more content, and we really do want it to be responsive to what you all are telling us are your priorities and what you want to learn more about. And I also see that people are engaging with the chat faster than I can talk and read at the same time, I will admit. I did see a lot of questions around the specifics of how we're defining the populations, and I think that is great content for the future because we could spend a lot of time talking about that as well. And there are some aspects that we are still seeking clarification on. So I think that's another really great topic for the future based on just what I'm reading through in the chat throughout our presentation today. And I can also say I definitely don't have any answers today about how dollars are flowing, but that seems like another really great topic for us to get answers from our experts so that we can bring you an accurate picture of what's being built and even let you maybe provide feedback over how that sits with you, because you all are truly the folks who are doing the work. You are the members. We have a really great, I see over 100 folks still on the line, so thanks for sticking with us. And I just want to call out that there's really great questions, many of which we will have to chase satisfactory answers to.
Yeah, some of the questions are around our metrics for the housing project and the waivers. That's a great one. There is a whole implementation plan that's being developed and reporting requirements. So more to come on that. I saw questions about how do people get referred for eligibility for the programs, and I think that's still TBD, to be determined. And so, again, these are great questions that can be used to develop future webinars and content that we may not have full answers to today, or even in the future, the immediate future, but will certainly help us in terms of assessing what the questions are and what we need to put together for future webinars.
Thank you, Rebecca. I do also want to say that while this webinar is one opportunity to engage with us, to learn with us, but that we also do plan to continue to build out community engagement as we have more built that people can see and react to, and things that we can visualize in a way that's meaningful. And that absolutely we want to hear from you. And we want to hear from organizations that are medical, organizations that are not used to our medical Medicaid model. And I see the call out to community action agencies from a few of you. Hear you loud and clear. Thank you so much. And in fact, that actually reminds me to go to our final slide, just because there's some information on this slide that might be useful to you. We are working also to get more regular updates, and we do have an official mailing list. So this GovDelivery URL is our official mailing list to get waiver updates. We always have our email address, that 1115waiver.renewal@odhsoha.oregon.gov. address. And oh, I also have good news. If you're here and you registered, that means you're signed up to get updates for our future monthly webinars. So you should be getting the information for the August one in advance of the August webinar. And they're currently scheduled throughout this full calendar year. So we have them through December on the books right now. And also that the registration link, as well as recordings, as well as these slides are all on our waiver website. We're trying our best to be as open and transparent about what we're sharing, even as we learn things that maybe continue to evolve. And I do want to say what we shared today is what we know right now, with the big caveat of we're going to continue to build and evolve. And there are things that you could let us know that could change the directions that we're building some of these things. So we're going to continue to try to get you the baseline information you need so that you can feel like you know enough to really let us know if we're off the mark. And we're very open to any feedback, any thoughts that you have, whether in a structured setting like this, or maybe you want to get our attention through that email inbox and have a different structure by which we're engaging together. And know that we're trying to get more things up and running, but in the meantime, we're continuing to maintain this webinar as one of those baseline places to get information. And yes, this webinar is always the first Wednesday of each month. I thought about changing it because of the holiday, but we went full steam ahead because we wanted to maintain consistency and we knew we were going to record it. I believe that means that August 3rd, can someone fact check me? Is that the first Wednesday of August? It might be. I don't want to pull up. Okay,
The second.
the second. Ah, so close. So we would love to see you on the second. We'll probably be focusing mostly on climate services, but that does not mean that we can't continue to take feedback on housing, on all these other components of the webinar. And I believe currently the ETA on housing support phasing in, which is being available maybe not to everyone, all of the supports and services at the same time, but as we have things that are ready to roll, mid-2024 is when we're hoping to begin phasing in housing supports. And then another reason why we're focusing on climate supports next is because that is currently scheduled for January of 2024. So that'll actually be the first of the health-related social needs to go live. Ooh, and while I'm talking, I do also want to say another really important thing happened July 1st. In addition to the Healthier Oregon populations going live across all age groups, we also, I believe, our systems began running continuous eligibility rules, which means that people continue to have more protected coverage. That's another part of the waiver we didn't talk about today, but we have a whole webinar about that if you want to learn more. And I believe that that's now operational, so people will be able to keep their coverage longer and have less of a burden in proving that they are still eligible.
Yeah, that one takes effect from July 19th.
Oh, sorry, mid-July. I'm glad there are people to keep me honest here. It's very soon. Thank you so much, Sean and Jewel. With that said, we're just about at the end of the hour. Please continue to feel free to put things in chat. It was moving just enough that we might not have called out loud what you wrote to us, but please know that we are recording all of this, both this presentation and what is in the chat, and that your comments, your questions are not lost.
One little update about the continuous eligibility portion, though, is that we did get funding from the legislature for adults to go ahead with that program for adults as well, not just children. That was an update since the last time we talked about continuous eligibility to this group. So that's some great news to share.
Oh, thank you so much, Sean. All right, I think we can stop recording, can hang out for a scotch longer in case people are mid-sentence typing information to us.